Having offices across Southern California in both San Diego and Los Angeles means that we, as an agency, have a unique perspective to be able to see plans that folks in both Los Angeles and San Diego counties have access to. And sometimes those plans are overlapping, and sometimes they even have the same name, but just because they are the same plan with the same name, with the same carrier, doesn't mean they are the same exact plan, especially when separated by two different counties. So today we're going to be talking about the Scan Classic plan that's available in San Diego, and then compare that to the Scan Classic plan available in Los Angeles to show how those plans can differ even though they're just divided by, 100 miles. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know has questions about their Medicare options, either during the AEP or really all year round, feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist over the phone or in person at one of our many offices across Southern California in English or Espanol. Oh, also, don't forget to like and subscribe. Now, just real quick before we get to the two Scan Classic plans separated by two counties, let's talk about Scan as a company as a whole. Now, Scan is an insurance plan that just focuses here in Southern California, and they are not like those other nationwide insurance behemoths who are good, they are very good, but it can be easy to get lost if you ever need to fix some sort of problem, even if it's something small, something like get something updated, or just get a new set of cards sent out to you. Furthermore, Scan was started by a group of seniors who wanted to create a plan with Southern California seniors in mind. So it just has a different way that it moves, and I think that's nice. Furthermore, they have some great doctors and hospital networks that are not always going to be easy to get access to with some of those other carriers. Oh, also, when we have clients who have a Scan plan, I always enjoy working with them because of their hyper focus on having such a high quality of beneficiary experience that getting anything done, getting anything fixed is very, very easy. So, Scan is good. Let's talk about the Scan Classic plan. First things first, let's talk about one of the things that I almost always start with when talking about plans with our clients is going to be the yearly limit on cost, because I think obviously that's a big deal, and it's really the biggest number. In Medicare, it's called the maximum out-of-pocket, or the MOOP, M-O-O-P. And it's one of the biggest differences between the San Diego and the Los Angeles version of the Scan Classic plan. On the Scan San Diego Classic plan, we can see that the maximum out-of-pocket is at $3,400. And frankly, that is kind of high. While the Los Angeles Scan plan has a maximum out-of-pocket that is $199. So, basically $200, which is, needless to say, very, very low. So why the difference in the maximum out-of-pockets and really the cost overall in general? Well, we're not going to get into all the wonky numbers because that'll get boring pretty quick. But although it may seem counterintuitive, cities oftentimes have less expensive than less populated counties as cost for their health care, primarily because of competition. There are just more doctors in competition for the patients that are available, while in less dense areas, in rural areas, for example, there are fewer doctors with more patients, which means that, basic supply and demand means that those doctors have a lot more negotiating power with the insurance carriers and push those costs up. Another area that the Scan Los Angeles plan really has one up on the San Diego version is going to be the cost for doctor's visits, or the copays. So this would be for things like the primary care doctor visits, specialist visits, so that could be cardiologists or pulmonologists or endocrinologists, because on the San Diego Scan Classic plan, they have a copay for primary care visits at $10 and specialist visits at $35. While in Los Angeles, the same services, primary as well as specialist visits, are $0 across the board. Again, back to my previous explanations. Next up, when we look at the hospital coverage, and I mean, this is another situation where the price difference is just so vast, but we can see that on the Scan Classic San Diego plan, the cost to spend the night in the hospital is $275 per the first 7 days, and then $0 from day 8 through 90, which I mean, is still a lot of money, but still pales in comparison to the cost if someone just had original Medicare and didn't have any other coverage. That being said, the Scan Classic plan in Los Angeles makes the calculation easy because, again, it's $0 for those hospital stays. Also, just as a side note, since we are on this page, we can see that both plans have the exact same cost for emergency care that is worldwide. So if you are visiting family abroad or have a heart attack while skiing in the Alps, somebody would have coverage, and I've had clients who've done both. Now, if we want to look at extra benefits, meaning things that are included on either Medicare Advantage plans that are scan in this case, but are not actually required by Medicare to be covered by those insurance plans because they're not covered under original Medicare, so people on original Medicare don't have these benefits, there's a very noticeable difference to be had with the dental coverage. This is because the Scan Classic San Diego, there is a basic dental plan that is available for basic and comprehensive dental services, but it will have an additional monthly cost per month, which is not too bad, really. If you look at the other kind of standalone dental plans, they tend to be a lot more expensive. But it is something that adds up over time. While, especially in comparison to the Scan Classic in Los Angeles, those dental benefits, all the same benefits, come in at $0 a month, so there's not much competition. Furthermore, for things like restorative services, there are going to be copays on both for the dental procedures, but in San Diego, it'll be between $34 and $595, which is kind of a wide range. I guess it depends on what you get. While in Los Angeles, it starts at $8, but only goes up to $395, so just lower on all sides. So yeah, another win for the Los Angeles Scan Classic plan. Last of today, and we will finish with a benefit they both plans have equally well, is going to be the monthly premium and the deductibles. And the premium is the monthly cost that a plan has that has to be paid by the beneficiary above and beyond whatever the Medicare Part B premium is in that year. In 2025, happens to be $185 per month. And the deductible is how much somebody has to pay prior to insurance helping out with those costs. So prior to getting access to copays and co-insurances and all those kinds of things. So the good news is on whichever plan someone chooses, whichever classic plan chooses, San Diego or Los Angeles, it is going to be a dogfall because they are $0 all around. $0 for everybody. You get $0, you get $0, you get $0. So I think one of the biggest points of all this, at least for this video, is the fact that despite having the same name, and despite being with the same company, and technically being the same plan, there can be some real sizable differences in the same plan from one county to another. Even at face value, they are, again, the same plan. This is a problem we have oftentimes with clients who move from one county to another and choose that plan they had before because like, oh, it's the same plan I have now. I like the plan I have now. Wherever I go, the same plan with the same name, with the same carrier, it's gonna have the same benefits. And then they find out later down the road that the benefits, the cost, the doctor's networks, the hospital networks all end up having to be changed because basically it's a different plan. And that can bring a lot of stress and confusion and just overall frustration and consternation until it gets worked out. That's where we come in. All right, so that's it for today. And if you or somebody you know is struggling, trying to figure out what is that best Medicare option for them, whether it is AEP or outside of AEP, please feel free to reach out to us at the information down below. Either me or one of my team will help walk through those tough Medicare choices at one of our many offices across Southern California, either in person or we can do it over the phone in English or Espanol. And also, don't forget to like and subscribe. So for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.